I think the 1,000 Live campaign is very important, partly because I've got a nursing background and then became the patient, and because it covers so many issues, and obviously the emphasis is on safety, which is, as a patient, is what we want to have at the top of the agenda. Well, I think we can improve safety just by listening to patients. As I said, patients are just people who happen to have an experience. More often than not, from the ones I've met, it's good, but there are instances where things have not gone perhaps as they might have hoped or expected. And just listen. I've said that to numerous people. Just listen and then see what we can do to move things on and improve. I think the one message really would be to take the campaign on board and to look at all the issues, and obviously to think, I mean, from a nursing point of view, I still have a huge issue around infection control, and I think that is one that we still need to be very serious about. I think there is still a lot of improvements that could be done. Quite simple, not expensive, but it could improve. I think that talking to patients, it's current, it's things that are happening now. My treatment was 5 years ago, although my husband's been treated recently, and things are always changing. So by talking to them, hearing about their current experiences, there may be trends that you can actually pick up on quite quickly. We have issues, as you probably know, at Velindre around radiotherapy waiting times, which really worry the patients. But if we're honest and we explain the situation, then I think people are a lot more comfortable with it. Might not be happy, but they do understand. Well, I think, yes, it is beginning to happen. Patients are being heard at board level. But I suppose I'm fortunate in a way, having a nursing training background. But I do think that some of them do need a lot of help and support. They want to be there. They want to sort of get involved in the discussions and contribute. But depending on their background, some of them obviously are very nervous, so there is a lot of perhaps preparation, help that some of them may need. Well, having gone from being the nurse to being the patient, I think the senior executives can learn an awful lot. Again, to use that word, listening, because yes, we know what to do, we know how to care, but you haven't been there, you haven't had that experience. And it's amazing how small things to a patient, which nurses, doctors, boards might not think about, are actually more important than some of the sort of high-powered, treatments and so on that they're thinking about. So I think it is just what have I just been through, and how can you learn from that? Well, it's a bit of an old cliche, really. I think the one example that keeps coming across is the communication bit. Unfortunately, nurses and doctors, we all know, are very, very busy, but most patients just really want somebody to talk to and have time with them. Again, I must say, in Velindre, we're very lucky because they all seem to be able to give you that time, but that's not necessarily everywhere. So I think the bit about listening and communicating is very much top of my agenda.